So I didn't actually find out about this specific specialty until I started working in private dental practices as a sedation nurse. It is obviously less stressful than working in emerge or ICU or whatever, but it is a little nerve-wracking sometimes.
Good morning. I'm on my way to my work. My husband is driving me today. We are gonna get there around 7 o'clock or 6:58. My shift starts at 7 o'clock.
So as soon as I get to the dental department, I have to start setting up the hallway for the patient and their family. I put the scale out and the vitals machines out. Then inside the recovery room, I set up the bed and I also do some safety checks, like making sure that the suction equipment is working, that there are multiple masks available in case of any airway emergencies, and of course setting up the vitals machines right beside the bed. Because I'm an emergency nurse, they have this resource manual, which is super useful to make sure that the nurses don't miss anything when they're working in this area. And I basically follow the checklist, like making sure that the code blue button is working, which I have to call the command center about. After doing all those checks, I also start preparing the patient's charts. I like to fill out their information ahead of time because when it gets busy later, it saves a little bit of time. I will also prepare the packages that the patients have to take home. Okay, so the first patient is in. After doing my safety checks and doing a little bit of setup for their recovery, what I did is that when the patient came in, I had to do their intake form, so reviewing their medical history and making sure that all the consents are signed for their dental procedure. So as a recovery nurse, I don't actually go into the operating room. I help set up the recovery area and then I help set them up to be under the patients that we have here. But after that, I just kind of wait until the procedure or surgery is finished. So usually the surgeries take around 45 to an hour and a half, maybe 2 hours. And then around that time, I'm just kind of supporting, and they usually don't need my help. And usually around this time, I will be waiting for the next patient, doing my intake again. And then as soon as that's finished, the next procedure would be done. And then I would recover that patient. And then it's just going to go from there until around 4 p.m. So right now, the first surgery is still ongoing. And my next patient is going to be here in 15 minutes. So I have a 15-minute downtime where kind of just doing some thinking and writing and maybe doing creative work. So yeah. So I just finished recovering the very first patient, and in terms of recovery, it's usually doing their vitals and doing their assessment every 5 minutes until they're awake and they're good to go or they're back to almost normal self. After that, you just clean the area again and make sure you refill all the things that needs to be refilled, like the suction, because I used it, so I had to put a new one in. I just did a little bit of catching up with my charting, and then I sent them home. So right now the second case is going, and I have a little bit of downtime again, and then I'll just wait for the next patient to come in. I'll do their history and their interview while I wait for the next patient to finish so that I can recover them. So we have 4 cases today, but basically that's the job. Okay, so we're actually in the last case now, and I'm just drinking my Tim Hortons coffee. I have not had lunch yet. At this time, I'm just going to clean up all the things that I can clean up right now while waiting for the last case, because then I'm going to close the whole place down and then go home from there. Hello, I'm currently editing the day in the life video, and I realized I never gave you the conclusion or maybe give you my 2 cents about this whole field because it is new to me. And if you're curious about it, so there are actually 2 nurses that worked in that dental department area. One of them is the OR nurse, and she's kind of the supporting nurse when I'm busy recovering, and let's say she needs to do the intake for the oncoming patient. And so she mainly works in the OR assisting the anesthesiologist while I'm in the recovery room. So I didn't actually find out about this specific specialty until I started working in private dental practices as a sedation nurse. I found this gig and I thought it was super cool as a side hustle, or even a main hustle if you are tired of the business of nursing in the hospital. It is obviously less stressful than working in emerge or ICU or whatever, those critical areas, or even med surge. But it is a little nerve-wracking sometimes because when patients come in, these are kids that I'm dealing with, and of course they were intubated essentially, and you have to basically watch their airway and make sure that there are no compromises and that they can breathe back normal. Of course, you're working with anesthesiologists, so you will have support, but at the same time, you have to really be comfortable with your airway techniques. So you need to know how to insert an OPA or an oral pharyngeal airway or an NPA or a nasopharyngeal airway, and also learn how to comfortably learn how to use the suction machine and oxygen and all that, as well as your techniques like head tilt, lift, or the jaw thrusting. All those things that you learn in the basic CPR course, you actually apply them in this specialty, I find, because in emerge, I didn't really get to practice that because there was the doctor and also the RT or respiratory therapist who was kind of the expert in that. But when you're working in a dental practice or even in recovery, knowing those skills, or you actually learn to use those skills more often, which are the life-saving techniques or skills as a nurse. So overall, I'm really enjoying this field of recovery nurse. It's actually making me rethink my whole nursing strategy, and maybe I'll go into recovery one day, who knows, but so far I really like what I'm learning here. It's not as stressful as emerge, but you're still using critical thinking skills, respiratory assessment, and all these important skills of being a nurse. And I think that's the most important thing when it comes to figuring out the career that you want, is to what is it that you love about that career, and see if you can kind of just take the things that you like and find that in a different specialty so that you can focus on being a good nurse. If you like this video and if you want to learn more, or if you want to know other stuff about nursing, let me know. And I hope that this video resonated with you, that you be kind to yourself and take it one day at a time. I'll see you in the next video.